Gentlemen, what if I told you that one of the most powerful natural compounds for cardiovascular health has been sitting in grocery stores for decades, and most men over 50 have never been told about it by their doctor? I'm Dr. Emily Carter, a board-certified urologist with over 12 years in clinical practice. I've spent a lot of that time correcting the misinformation men over 60 receive about blood flow, vascular health, and the compounds that actually move the needle clinically. Today, I want to give you what the clinical evidence actually says, not what the internet says, not what a supplement company is selling you, but what the research shows. Before we go further, if you've been told conflicting things about natural approaches to cardiovascular support, drop a comment below. Tell me what you've heard. I want to know what misinformation is circulating, because what I see in clinical practice is that men are either dismissing natural compounds entirely or chasing the wrong ones based on bad information. Here's what most men over 50 have been told: that vascular health is about cholesterol numbers and blood pressure medication. Full stop. Take the statin, take the beta blocker, and that's the conversation. Here's what's wrong with that picture. It's incomplete. The clinical evidence now shows that nitric oxide bioavailability, the capacity of your blood vessels to dilate efficiently, is one of the most significant and under-addressed factors in cardiovascular aging in men. And there is a specific compound derived from a tiny seed most men walk past in the grocery store that has measurable effects on that mechanism. The research is not preliminary. The studies are rigorous, and yet almost no one is talking about it in the context men over 50 actually need. Let me give you the biological picture first, because this is where most explanations fall short. Your vascular endothelium, the thin layer of cells lining every blood vessel in your body, produces nitric oxide continuously. Nitric oxide is a signaling molecule. Its job is to tell the smooth muscle surrounding your arteries to relax. When it does, the vessel dilates. Blood flows more freely. Pressure decreases. Oxygen delivery to tissue improves. This is not a fringe concept. It is the mechanism behind an entire class of cardiovascular medications, and it is the reason Luigi Ignarro, Robert Furchgott, and Farid Murad received the Nobel Prize in Physiology or Medicine in 1998 for their work on nitric oxide as a signaling molecule in the cardiovascular system. Here is the clinical reality of aging, gentlemen. Nitric oxide production declines with age. Research from the University of Texas Health Science Center tracked vascular endothelial function across age groups and found that men over 50 show measurably reduced nitric oxide synthase activity compared to younger cohorts, meaning the enzyme responsible for producing nitric oxide becomes less efficient. The result is what clinicians call endothelial dysfunction. The vessels are stiffer, they are slower to respond to demand. Blood pressure rises not only because of arterial stiffness, but because the signaling system that should be dilating those vessels is underperforming. This is the mechanism. Now here is where the tiny seed enters the picture. The seed is flaxseed, Linum uctitissimum, and the specific compound driving its vascular effects is a class of molecules called lignans, specifically seicoisolaraceresinol diglucoside, which I will call SDG from here forward, because we are not here to practice pharmaceutical Latin. SDG is a plant-based polyphenol with a precise and well-documented mechanism of action. In the body, gut bacteria convert SDG into two mammalian lignans, enterodiol and enterolactone. These compounds have antioxidant properties and, critically, they have been shown to reduce oxidative stress on the vascular endothelium. Oxidative stress is one of the primary mechanisms that degrades nitric oxide before it can act. By reducing that oxidative load, lignans protect the nitric oxide that your body is already producing and allow it to function as intended. That is the biological layer. Now let me show you what the research actually found. A randomized controlled trial conducted at the St. Boniface Hospital Research Center in Canada, one of the most rigorous studies on flaxseed and blood pressure to date, enrolled 110 patients with peripheral arterial disease. Participants were assigned to either consume 30 grams of milled flaxseed daily or a control product for 6 months. The results were clinically significant. Systolic blood pressure in the flaxseed group dropped by an average of 10 millimeters of mercury. Diastolic pressure dropped by 7 millimeters of mercury. To put that in clinical context, a 10-point reduction in systolic pressure is comparable to what some first-line antihypertensive medications achieve in similar populations. The researchers attributed a substantial portion of this effect to the lignin content and its impact on vascular function. Plain English. In a controlled study lasting 6 months, consuming flaxseed daily produced blood pressure reductions in the same range as medication in patients who already had established vascular disease. A second study I want to highlight comes from research published in the European Journal of Clinical Nutrition, examining 15 randomized controlled trials with a pooled analysis. The meta-analysis found that flaxseed supplementation was associated with a statistically significant reduction in both systolic and diastolic blood pressure, with the effect most pronounced in studies lasting longer than 12 weeks. This matters because it tells us the mechanism is not a short-term acute response. It reflects actual adaptation at the level of vascular function over time. Now I want to address alpha-linolenic acid because it is the other major active compound in flaxseed, and it works through a different mechanism that is equally relevant to men over 50. Alpha-linolenic acid is an omega-3 fatty acid. Most men know omega-3s from fish oil. What they do not know is that flaxseed is one of the richest plant-based sources of alpha-linolenic acid available, and the cardiovascular research on this compound is substantial. Alpha-linolenic acid reduces platelet aggregation, meaning it makes the blood less prone to forming the clots that underlie heart attacks and strokes. It also has documented anti-inflammatory effects at the vascular level. A study from Harvard's Department of Nutrition, which followed over 76,000 women and 43,000 men across multiple cohorts over more than 2 decades, found that higher alpha-linolenic acid intake was associated with a significantly reduced risk of cardiovascular disease mortality. The effect was dose-dependent and consistent across subgroups, including older participants. The mechanism here is not nitric oxide directly. It is the inflammatory environment surrounding the endothelium. Chronic low-grade inflammation is a major contributor to endothelial dysfunction, arterial stiffness, and plaque progression. Alpha-linolenic acid reduces circulating markers of inflammation, including C-reactive protein and interleukin-6, both of which are associated with accelerated vascular aging in men. Here is what's wrong with how men have been told to address these issues. The conversation is almost always framed as medication versus doing nothing. What the clinical evidence shows is that specific dietary interventions have measurable, quantifiable effects on vascular function. Effects that are not trivial, not placebo-driven, and not in conflict with conventional treatment. They are additive. Men who are already managing blood pressure with medication can still benefit from improving nitric oxide bioavailability and reducing vascular inflammation. These are not competing strategies. Let me give you the practical picture now, what this actually looks like in terms of implementation, and what the research supports in terms of dosing and form. The most clinically relevant dose across the studies I have reviewed is 30 grams of ground flaxseed daily. This is approximately 2 tablespoons. Whole flax seeds pass through the digestive system largely intact. The hull is resistant to digestion, and the bioactive compounds inside are not fully released. The seed must be ground to make the lignans and alpha-linolenic acid bioavailable. Pre-ground flaxseed, or flaxseed meal, is the appropriate form. Because alpha-linolenic acid is susceptible to oxidation, ground flaxseed should be stored in an airtight container in the refrigerator. This is not a minor detail. Oxidized omega-3 fatty acids lose their anti-inflammatory activity and may produce compounds with the opposite effect. The research supports consistency over intensity. The blood pressure reductions documented in the St. Boniface trial took 12 weeks to become fully apparent. This is not a compound you take for 3 days and assess. The vascular adaptation is gradual and cumulative. If you are going to evaluate whether this is working for you, You need to monitor your blood pressure over a sustained period. At minimum, 8 to 12 weeks of consistent use. The second step that the evidence supports is pairing ground flaxseed with adequate dietary nitrate from vegetables, particularly dark leafy greens and beets. Nitrate from food is converted to nitrite and then to nitric oxide through a pathway that is independent of the endothelial nitric oxide synthase enzyme. This matters because it gives your body a second route to nitric oxide production, one that bypasses the age-related decline in enzyme activity I described earlier. The clinical evidence on dietary nitrate and blood pressure is robust. Research from Queen Mary University of London found that daily dietary nitrate from beetroot juice produced sustained reductions in blood pressure in hypertensive patients over a 4-week period, with effects maintained throughout the study period. The third component supported by the research is resistance exercise. I include this here not because it is a surprise, but because the mechanism is specific and relevant. Resistance training, particularly moderate intensity work using large muscle groups, has been shown to acutely increase nitric oxide production through mechanical stimulation of the endothelium. Blood flow during exercise creates shear stress on vessel walls, which upregulates nitric oxide synthase activity. Over time, this training effect is maintained even at rest. A study from the University of Maryland examining older men found that 12 weeks of moderate resistance training produced measurable improvements in flow-mediated dilation, the clinical test for endothelial function, compared to a sedentary control group. These three components together, ground flaxseed for lignin and alpha-linolenic acid content, dietary nitrate for the alternative nitric oxide pathway, and resistance exercise for endothelial stimulation, address vascular aging through distinct and complementary mechanisms. Each one is supported by clinical evidence. Each one produces effects that are measurable on standard cardiovascular assessments. Gentlemen, here is what I want you to understand. The men I see in clinical practice who are struggling with elevated blood pressure, reduced exercise tolerance, and the general cardiovascular decline that comes with aging are not failing because they lack willpower. They are working with incomplete information. They have been told to wait for a number to cross a threshold before taking action, and they have not been given the full picture of what the evidence supports in terms of modifiable factors they can address today. You now have the full picture. The mechanism is real, the research is rigorous, the intervention is accessible. 2 tablespoons of ground flaxseed daily is not a dramatic lifestyle overhaul. It is a precise, evidence-based addition to what you are already doing. And the vascular effects it produces over time are clinically meaningful. Tell me one thing you believed about blood vessel health that this video changed. I read the comments, and what you tell me shapes the content I create for this channel. I'm Dr. Jocelyn Carter. The clinical evidence is clear. Nitric oxide bioavailability declines with age. Flaxseed lignins protect that system through a well-documented antioxidant mechanism. And the research supports measurable cardiovascular benefit at a dose of 30 grams of ground flaxseed daily. Take care of yourself, and I'll see you in the next one.